One of the challenges of development is that we tend to look at development in silos. So people look at economic development, they look at health development, and they look at education development. But I think those of us that are interested in health realize that you're not really going to get the complete transformation in health that's needed unless you transform economic development and education at the same time. And I think the power of the mobile platforms, the telephone, is that it can do that together in a way that was never done before. And the other remarkable thing about visiting Kenya at the moment is everywhere you go, you see the sign for M-Pesa, which is mobile money. And the power of the mobile phone to transform economies by just making it possible for me to text any one of you in this room small amounts of money in a secure way. So I think the challenge is about partnership and collaboration. And that is what the Pacific Health Summit is all about. It's about breaking down silos. It's about breaking silos down between people who come from different disciplines, who come from different countries.
This year's theme is focused on integrative approaches to the technologies for improving health globally. How can we use new advances to implement cost-effective novel approaches to both acute and chronic disease? There is, in my opinion, an important policy divide that must be bridged if we are to implement these themes. The policy divide is that we in the healthcare profession must rethink one of the cherished paradigms, that is, that the healthcare professional must implement, read, initiate, and interpret the technology. This approach is a major disruption to the development and use of these disruptive technologies. We are decades away from training and retaining the healthcare workers required to perform such screening assays. And despite this, many countries are passing regulations mimicking the Western countries, like mine, that requires extensive training even to perform the simplest of assays. Foolproof technologies allow a different paradigm, one which I hope we will discuss at this meeting.
I think really in health we haven't really embraced fully the potential of new technology. When we think technology, it's about new surgical instruments or new tests and so on, and of course that's very important. But it's also the new technology that is transforming the world. The game changers are really the people who use it or not using it. And there I'm more optimistic for low and middle income countries to come up with the innovation and to be rapid adapters of innovation. Because one, there is a challenge of a huge shortage of healthcare professionals. That's one thing. The systems are being built up. They're rooted to tradition. So this is where the innovation is going to come from. But also, I think that we shouldn't neglect the other factor, and that's people. Public trust in new technology is not always there. It can even be rejected. There can be paranoia. Think of the declining immunization rates in several countries, including in this one, although it's going up again. So we should not miss that opportunity also to have a discussion about the people and the communities and the perceptions as much as about what this technology can bring.
For the first 3 years of the Pacific Health Summit, you may not know that the co-chairs of the Pacific Health Summit were Bill Gates Sr., the father of the Microsoft chairman, and still one of the co-chairs of the Bill and Melinda Gates Foundation, and George Russell. George Russell was chairman of NBR, the Summit's Secretariat. And George, if you don't know, is also the Russell of the Russell 2000 stock index. For the first 3 years of the Pacific Health Summit, every single person, hundreds of people every year, was invited to the summit with a personally signed and addressed invitation from Bill and George. And what it represented was really their fundamental belief in personal leadership, in the difference that an individual can make in this world. And they wanted to address those letters to each of the participants and invite them and challenge them to do something very important. So when I look at the theme for this year's summit, Game Changers, Affordability and Technologies for Health, what I would remember from what George and Bill would talk about is the game changers aren't the technologies. The game changers are the people in this room.